Hello everyone, today we will discuss anti-diabetic drug. It is an important topic asked in various competitive NEET PG INSET exams. It has various classes of drug. First one is GLP-1 related, another one is ATP sensitive potassium channel, the third one is your SGLT2 inhibitor, fourth is your alpha glucosidase, and fifth one is your thiazolidinediones. One is your biogonide, which we will discuss later. First, in GLP-1 related drugs, we have two classes. One is your GLP-1 agonist and another one is DPP-4 inhibitor, because DPP-4 actually metabolize GLP-1. ATP sensitive, we have two classes, sulfonylureas and meglenidides. Now we will discuss these four classes. GLP-1 analog drugs contain glue in their name. DPP-4 contain gliptins. Sulfonylureas start with G and meglenidides contain glinides in their name. SGLT2 inhibitors contain gliflozin in their name. Alpha glucosidase inhibitor, we have three drugs, acarbose, voclibose and Miglitol. Thiazolidinediones contain glitazone in their name. For example, like in GLP-1 analog, we have liraglutide, gliptins, melinagliptin. Sulfonylureas, we have gluburide and glycoside. Meglenidides, we have repaglinide, netiglinide and metiglinide. In gliflozins, we have canagliflozin, dapagliflozin. Thiazolidinediones, we have pioglitazone and rosiglitazone. So these are our main classes of the drug which we have discussed. One more is biogonide, which contain metformin, which we will discuss sometimes after some time. Okay, so now which type of questions asked from these? Main is their side effects, and most common which is asked is about their weight. So among all these classes, the only class which cause your weight loss is your GLP-1 analog, that is your liraglutides, and it means the drugs ended with glutide, and one which is weight neutral is your DPP-4 inhibitor. Rest are causing your weight gain. So in this way you can remember weight loss only one class, GLP-1 analog, and weight neutral only DPP-4 inhibitor. Now another side effects, both these GLP-1 related cause pancreatitis. This one is important. And these your ATP sensitive potassium channel cause your hypoglycemia, both these classes. Now thiazolidinediones mechanism of action is they stimulate ENaC channel, therefore cause water retention and edema. So their side effect is water retention and edema, and they can also cause CHF. One main side effect which is most commonly asked is your bladder cancer caused by pioglitazones. Therefore pioglitazone come with a black box warning, and MI is also more common with your rosiglitazone. One more side effect is your bone fracture in female and hepatotoxicity. Now the next is your alpha glucosidase inhibitor. Their side effect is flatulence and osmotic diarrhea. Why? Because their mechanism of action is inhibiting starch breakdown in your intestine. Therefore starch and polysaccharide will not get absorbed, so they will remain in your small intestine and cause flatulence and osmotic diarrhea. Next is your SGLT2 inhibitor. SGLT2 inhibit in your kidney. Therefore glucose and water will come out through your urine. Therefore it causes vaginal infection, UTI, dehydration and hypotension, because glucose is lost in your urine. Therefore risk of infection is increased with SGLT2 inhibitors. Now some more common points are canagliflozin also cause increased risk of limb amputation, and DAPA increased risk of bladder and breast cancer. SGLT2 inhibitors also cause euglycemic diabetic ketoacidosis, which is mostly asked about this drug, which class of drug cause euglycemic decay. Now these two classes, GLP-1 agonist and SGLT2 inhibitors, also decrease cardiovascular mortality. Therefore we can use these two classes in CHF patient. Now one important drug is your biogonide, that is your metformin. It has multiple mechanism of action, but main is it stimulate AMPK, that is your adenosine monophosphate kinase, therefore inhibit gluconeogenesis. It is also weight neutral drug like your DPP-4 inhibitor. Its side effect is it decrease vitamin B12 absorption and also cause lactic acidosis. This side effect is also more commonly asked. Now thiazolidinediones mechanism of action, I didn't tell earlier, it stimulate PPAR gamma. Gamma is your G, so glucose inhibition. Okay, now this metformin is your drug of choice in treatment and prophylaxis of type 2 diabetes mellitus in your pediatric age group 10 years age and PCOS. Okay, so now we discuss the side effect, decrease vitamin B12 absorption, but if treatment is given with calcium, we can increase vitamin B12 absorption. So if the question is asked megaloblastic anemia is caused by, so it is by metformin. Now, which drug is contraindicated in renal and hepatic failure? This type of question is also very commonly asked. Okay, so first one is your GLP-1 analogs. In GLP-1 analogs, GLP-1 agonist, these are your contraindicated in renal failure except your liraglutide. Similarly, DPP-4 inhibitors are also contraindicated except your linagliptin. In sulfonylurea, both renal failure and hepatic failure. In case of both renal and hepatic failure, sulfonylureas are contraindicated, but in case of meglitide, these are not completely contraindicated. We decrease only dose. Now, metformin is contraindicated in liver failure, but in case of renal failure, if your EGFR is less than 45, you will only decrease the dose, but if it is less than 30, it is completely contraindicated. We can't give. Next is your alpha glucosidase inhibitor. It is also contraindicated in your renal failure. So in this way, I have told you all the drugs which are contraindicated in renal and hepatic failure. Now, some miscellaneous anti-diabetic drug include pramlintide. Its name contains amylin, so it is an amylin analog. Another is bromocriptine and colesevelam. Pramlintide also causes weight loss. So we have two weight loss drugs, which is pramlintide and your GLP-1 analog, and two weight neutral drug, DPP-4 inhibitor and your metformin. Okay, so these thiazolidines also inhibit PPR alpha, therefore also decrease triglyceride. Along with glucose, they can also decrease triglyceride. So PPR alpha decrease triglyceride, and PPR gamma is your G, glucose. So PPR gamma से decrease glucose and PPR alpha से decrease triglycerides. So in this way we concluded all our drugs. Thank you for visiting my channel. Come back to